Hello, my name is Andy. I'm product manager and marketing manager at RZ Medical. We are here at the Urology Congress EAU 2024 in Paris. I have the pleasure to have Dr. Felipe Figueiredo with me. He is the inventor of the MiLEP system. It's a minimal invasive laser enucleation procedure of the prostate. What is the benefit of MiLEP?
Yeah, this concept is something new in the field of urology because since 100 years ago, urologists are doing transurethral treatment of BPH. And usually we have this Iglesias system, which is continuous flow, and you have a loop for resection of the prostate. And with the 26 French, you have the 24 French loop that allows efficient resection. If you decrease the size of the sheath, you have to decrease the size of the loop and you lose efficiency. So for a long time, people are using the same instrument for their transurethral surgeries. But with laser enucleation of the prostate, the fiber is very small, 0.5 millimeter. So why are we still using the same instrument? And the idea is to be able to use smaller resectoscopes to perform the enucleation. So we have the 22 French resectoscope available and also an 18 French resectoscope. You see the difference is very huge, and we are able to reduce the trauma to the urethra and the sphincter, and in that way it's possible to avoid the most feared complications of MiLEP, which are urethral strictures and transient urinary incontinence. You have to adapt the technique to avoid damage to the sphincter, but there's no learning curve to make the transition from 26 to 22. So the idea was to reduce the friction with the holes. So instead of the big holes of the standard sheet, we have a very small hole. So during the enucleation process, you don't have so much friction in the mucosa of the sphincter. We also have this new obturator that fits directly the outer sheet. So during the introduction, it's blunt and you don't damage the distal urethra, the subnavicular valve. And once you are in, you have the 19 French inner sheath and the laser working element. So it's the same instrument that we have for the 26. Excellent flow, excellent vision. The scope is a little bit smaller, it's 2.9 millimeter. It's not the same as the 26, but the quality of the vision is the same. You have available 12 degrees, 30 degrees, depending on the region. It's the perfect resectoscope, and you can do everything you can do with the 26 with less urethral trauma. The key point was the possibility to morcellate through this sheath. That there was no solution available in the market. No other company has, but we have developed together a morcelloscope. So we remove the inner sheath, we keep the outer sheath, and then we have this instrument. So you don't need any adapter. You just put the morcelloscope in the same outer sheath. You have a 5 millimeter working channel, 2 large irrigation channels, so you can put 1, 2, 3 inflows if you want to increase the inflow. The vision is great, but it's fiber optic. So the key was to reduce the optical system to have the largest possible channel for irrigation and to fit all morcellators available in the market. So this solution, now we have the complete set to be able to treat any size of gland with less urethral trauma. But we also have available the 18 French resectoscope, which in smaller urethras, in smaller prostates, some bladder stones, to reduce even more the urethral trauma. So 18 French. You can do all the enucleation for small prostates. I do up to 80 grams. But for morcellation, you have to change to the 22 French outer sheet to introduce the morcellation. The benefit is that usually the trauma is during the movements of the enucleation. So if you do the movement with an even smaller sheet and you use the 22 just for morcellation, you'll be stable, you won't be moving, so you have less trauma. Just with the introduction of 22 is not very traumatic. And this is a game changer. My practice has completely changed. Now I do only BPH surgery, only nucleation with this more system, MiLEPs, minimally invasive laser nucleation. I'm doing 10, 12, sometimes 14 cases per week. I don't do any other kind of surgery. We see a growing interest in different countries, so we have people doing this in Italy, in Poland, in Chile, Argentina, even in India, and it's great time to be alive.
Yes, so we go back from whole lab in 26 French. This is the standard size.
Which is also available for RZ, but in my practice, I don't use it.
So in the past we had to use, instead of this dedicated Morse scope, we had to use this adapter solution.
It's a bridge, so it's another item, and we use it in the long nephroscope from PCNL.
And this is not a dedicated system for morselation. This is a PCNL nephroscope which currently is used on the market. So this is a dedicated solution, and if you use the 18.5 French, we even have created a one-step obturator. So this is what you mentioned before.
Yeah, usually the standard resectoscope, you have the outer sheet, you have the inner sheet, and then the obturator. So you have two steps that during the introduction at the meatus, sometimes you get stuck. If you force it, you can damage the urethra and have a meatal stenosis. So besides with the reduction of the size, which reduces the trauma, we created a larger blunt obturator that fits directly the outer sheet. So we have only one small step, not two steps. And the step with the ceramic tip is wider. So it's much easier to make the introduction through a small meatus. You don't have to cut with Otis or to make a forceful dilation with the metallic dilator. It's much easier to negotiate and to enter atraumatically.
Yeah, thank you very much for your great explanation. For any questions, you can use our social media channels or the contact via emails. And thank you very much for your time. And
I hope you enjoy it.
Take care.